all chief residents and even residents, we've all been in front, and whenever we present something, we always do a case. You know, we always got to bring in a case. And although this is a very hypothetical case, so to speak, it will appear all too common, I think, to many of us. It brings us kind of all into the world of autism when a parent shows up in your office with their 3.5-year-old child, whose former pediatrician said that their child might be autistic, and now they come to you. If you're lucky, it's not in a 10-minute slot. It'd be nice if it was a problem visit. You know, you have as much time as you need to do so, but you can't always guarantee that. In summary, her history is as follows. It's full-term infant, born G1, now P1, to a 34-year-old mom, born by C-section due to failure to progress. Mom had excellent prenatal care. The first trimester was a little complicated, a little rocky, as many women may attest to, some hyperemesis in the first trimester. She was on Zofran, kind of off and on, more on than off for the first 2 months. She's diabetic, actually, well controlled with insulin during pregnancy and without. The birth was uncomplicated overall. The baby was born. He was born at 8 pounds, 2 ounces. He was discharged home on breast milk. Mom says she breastfed him for about 2 months or so, but had to go back to work, as we all can attest, and started the infant on milk-based formula. He was diagnosed with kind of a colicky, questionable milk protein allergy, never had any blood in the stool, just seemed real irritable and gassy. I don't know how many times we hear that one. Was changed to Alimentum by their pediatrician and had some relief of the infant's symptoms. At a year, the toddler began whole milk, but seemed to kind of throw it up a lot, so Mom had it changed over and put him on soy. She reports the infant didn't roll over till about 6 months. Seemed okay, but the doctor said he was a little delayed in his motor skills. He crawled at about 8 months, cruised at about a year, walked around 17 months. Socially, when asked, she said he smiled occasionally, about 2 months of age. She does kind of worry about the way he plays. You know, he loves and obsesses about her cell phone, but he doesn't ever talk on it. He just kind of sits there and pushes the buttons. She also says he has huge tantrums. All 3.5-year-olds can have some zingers, but she says these just don't seem right. They go on for a very long period of time. And he seems just really out of control. It's very hard for her to manage him. He seems to wander around a lot sometimes. He just kind of has these spells where he's not really listening or just isn't there. His verbalization is a little delayed. He babbled at about a year. No real words. Kind of said mama and dada about 18 months. She never really knows if she says it to him. He says it to her. Mom reports now. He talks a little. He says mama, dada, car. Says no, 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 no a lot. She says she's encouraged by his speech, though, because he really repeats a lot of what she says. And a lot of it's the last word that she says. Watching him in the room, you kind of see he's not really listening to her. He's playing with the cabinets a lot. His immunizations are up to date. Family history is significant a little bit. Mom's sister's daughter has some learning issues. Not really sure quite what that's about. You can imagine the physical exam, if we've all experienced, is a little difficult. He's playing in the cabinets. He doesn't want to make eye contact. Doesn't even want to acknowledge you're there. Claps his hands a lot, especially when his mom raises her voice. She tries to redirect him, but he doesn't seem to listen. So we try to do the exam on the mom's lap. He cries during the entire exam. His height and weight are okay. Nurse says there's no way we could get a blood pressure. We know that one. Like, what was his blood pressure? Nurse says, impossible. He's got a normal exam, so he's got a couple subtle things. A little hand flapping, you noticed when he was in the room. It's a little ptosis of his right eyelid. He's got a high arched palate, kind of flat feet, a little distended abdomen, so to speak. He kind of scribbles on the table, but he really won't copy any figures. He holds his pen in a fist and doesn't seem to know what to do with it sometimes, just kind of scribbles on himself. This is what we get. In the general pediatric world, well. And I think that's the hardest question to answer, and as we go through our panelists, I think it'll get even harder. We have a definition. Ed Spence and I were talking about that definition. You know, the definition gets more vague and more vague. We do know a couple of things. Affects about 1 in 120, 1 in 100, 1 in 150 children. Boys tend to be about 3 to 4 times more than girls for diagnosis. There tend to be familial patterns we see. You know, you'll have one parent with one child who's autistic. So is the next one. So is the next one. What's also interesting is even if those other children don't have a diagnosis of autism, they tend to have some learning issues at times. There's a high monozygotic twin concordance, 70 to 90%. A lot of these kids, and I brought that up with our case, have some GI issues even very early on and may continue on. And some have seizures. It gets more complicated when you look at some of the DSM-4 TRs and the DSM-5s. You get into this huge realm of how do you make that diagnosis? Rarely do any of us do this. Rarely do any of us have this right next to us and start checking off boxes. I did it for you. In the description of the child and the case that I described, I highlighted the child's impairments, and he does fit the criteria for the diagnosis of autism. Even though this is a hypothetical patient, I think we can all see some of this, and it may be familiar to everyone here. With our panel, I think it's our approaches to these children which differ that make the case.